Good morning and welcome to Today in Putnam County, hosted by Putnam County Mayor Randy Porter, the show that takes a look at the events and what's happening all around Putnam County, as well as interviews with local, community, and business leaders. And now, sharing his insights and experience, here's Today in Putnam County with County Mayor Randy Porter.
Good day, and thanks for joining us this week for Today in Putnam County. I'm County Mayor Randy Porter, hoping you have a great weekend. Our show this week, it's about one of our great assets we have here in our region, and that's the Cookeville Regional Hospital's Cancer Center. And they've got a new partnership with Vanderbilt that we're going to talk about today. My guests this week are the hospital CEO, Buffy, and Dr. Waleed Khalaf with Vanderbilt Ingram Cancer Center. Good day, guys. How are y'all?
Hey, thank you, Mayor Porter, for inviting us back.
Absolutely. Glad to have you on the show.
Good day.
Doc, you're new to the show, and so we're glad to have you today. You know, I was thinking with October being Breast Cancer Awareness Month, and we were talking November is lung, pancreatic, stomach, and prostate cancer month, and I get a lot of questions here lately about the cancer center and the new agreements that y'all are bringing in with Vanderbilt, and you know, what's it going to do to the cancer center? Is it going to be a good thing, and all those kind of things? And so I thought we'd have a show where we just answer all those questions the best we can and let everybody know and get the information out there. So, Buffy, the Cancer Center's been a huge part of our community for, 28 years?
Yes, since 1996.
You know, as you know, my wife had breast cancer a couple of years ago, and she thinks that's her heroes, okay, at the Cancer Center.
Yeah.
And I have to say, they treated us so nice. And she felt so comfortable. And I've heard oodles of others say the same thing. So everybody just wants it to stay good.
Yes, absolutely.
But you're looking with this partnership with Vanderbilt to actually try to make it better, right?
Absolutely. First of all, let me just say, Randy, thank you again for having us on here today. And, you know, our cancer center started in 1996. I've had a family member as well. My stepdad was a patient at the cancer center in 2001, 2002, and he absolutely loved it. And it was so nice having it here at home. And I think that's why it's such a passion for me to keep these services here. You know, in 2009, we moved into the new space, about 33,000 square feet of space.
Very
it's
nice.
Absolutely beautiful.
It is.
And we can not only do infusions and clinic time there, but we also do radiation oncology there, which a lot of places will have you go somewhere else to have that done. So that's a really good asset for us. How we kind of got involved with Vanderbilt Ingram Cancer Center, I'm a Vanderbilt graduate as well, so I knew a little bit about Vanderbilt, obviously, and the Cancer Center. But, you know, we send a lot of our patients to Vanderbilt and some of the other higher levels of care when they need additional treatment. Yeah. And so we just started thinking, wait a minute, why can't we have that additional treatment here? Why can't we have those expanded services here? You know, like I said, we have a fantastic cancer center and have for many years, but what can we do to bring that even closer to home? You know, let's not treat our patients and then they have to go somewhere else for the rest of their care. Let's do it right here where they're at home. So,
well, if you're a cancer patient, Doc, and you're having to drive to Vanderbilt, which Vanderbilt's great, okay? I've had a lot of friends and some great stories to tell about Vanderbilt and the great treatment they got there. But if you're having to drive to Vanderbilt every day for radiation or chemo or something, it's bad enough that you're having to take those treatments. But to drive, as we were talking about Nashville traffic and get backwards and forwards, this just really makes sense, doesn't it, for Vanderbilt to partner with the hospital here?
Absolutely. And I just want to say thank you for having me here. It's an absolute honor to be with you and with your listeners. You know, this relationship is really natural for us. I mean, at the Vanderbilt Cancer Center, we try to do this more and more, bring cancer care closer to where the patients live. And so when we started talking with Buffy now almost 2 years ago, this really was natural for us. The idea of bringing high-quality cancer care to the Cookeville community is absolutely a vision of ours, and we jumped at this opportunity, of course. Our main priority is patient care here. And like you said, some of those treatments are daily, like radiation. And a lot of people are not able to go to Nashville, to the big city and the big hospital to get their care. And so what we strive to do is to bring that care closer to where the patients live. So this was truly natural for us.
Talking with Buffy Key and Dr. Khalaf from Vanderbilt about the joint partnership with the Cancer Center here at Cookeville Regional. So, Buffy, when you're looking at this partnership, I mean, you're getting a large group of specialists at Vanderbilt that's going to be available to help. But what as far as changes, somebody has cancer and they need to go to the cancer center. Are they going to see any major changes, or is it kind of going to be business as usual? How's that going to be?
For the patient themselves, it'll be seamless. And I say that a little bit tongue-in-cheek right now because during our transition period, we're transitioning different providers and things like that. But this whole professional services agreement that Vanderbilt and CRMC Cancer Center have is that all of the physicians and the advanced practice nurses that are in the clinic will be Vanderbilt, 100%. And so that's probably the only change, honestly, that you'll see. It's still our staff. It's still our CRMC homegrown folks who we love and adore, obviously. So the patient won't see that. What the patient may see, though, is just like what Dr. Khalaf mentioned, the fact that now they're going to have that opportunity to not only have that Vanderbilt provider there, an advanced practice nurse, but it opens up the door to have that Vanderbilt second opinion where they need it. So we've not only added 3 to 5 different providers for the CRMC Cancer Center, but we've added probably tens of many other physicians at Vanderbilt that are actually involved possibly in that case for discussions and things like that. Not to mention clinical trials. Cancer, unfortunately, there's a lot of cancer. And there's plenty of cancer to go around in the country, and we can't do enough quick enough. And so when you start looking at clinical trials and what, the World Health Organization, National Institutes of Health, and those kind of folks are doing and trying to help with cancer care, and Dana-Farber and places like that, let's be a part of that. And so through Vanderbilt, as we settle down through this transition, we'll be able to offer more clinical trials and stuff. And again, right here at home.
That's the great part. I looked up on the CDC website, and it had that there was over 2 million cases of cancer in 2023. That's huge, isn't it? And that was up like 11% from prior 2 years. And then I was looking, I drilled down, and it said there was an average of 419 cases per year just in Putnam County.
Yeah.
I mean, we're a county of 83 or 4,000 people. If you're thinking every year there's 400 or 500 people just here in Putnam County having cancer, I can't imagine what you're seeing at Vanderbilt.
No, it's absolutely right. And the trend, unfortunately, now is an increase in young adults with cancer.
Wow.
I mean, we unfortunately see routinely people in their 20s and 30s and 40s with cancer. There's a big trend upwards, especially with GI cancers. And that's unfortunate, and it speaks to the need for, obviously, early detection, prevention, and screening. But it also emphasizes the need for truly a comprehensive team approach that have access to the most recent treatment modalities that can help those patients, of course.
We probably don't have the answer to this, but I'd love to hear everyone's thoughts. We've been dealing with cancer for a long time, and we probably were dealing with it before we ever knew what it was for years. I think back as a kid growing up, and there's people died of stuff, and you think they probably had cancer. Mm-hmm. But are we any closer, Doc, to figuring out what's causing it? I mean, if we got all these new cases of intestinal cancer and all that, it's got to be something reading or drinking or
environmental of some
sort. Anything on the horizon that you know of?
Well, this is a really exciting time in oncology and cancer care. The idea of approaching cancer with toxins and chemotherapy hopefully is changing. We have two very new exciting technologies. The first one is using targeted therapy. Okay. So truly now we have the capacity to study the cancer cell at the genetic and at the molecular level to understand some of the changes at the gene level that are driving the growth of the cancer cell. But more than that, if we identify some of those mutations or changes, we're able to target it for therapy. And some of those treatments are actually oral. So a lot of the cancer patients are now on oral treatments, maintaining their quality of life, which is fantastic. And it's truly changing outcomes. The second approach is using immunotherapy. So using and manipulating the immune system to treat cancer. Some of them are activating approaches to activate the immune system, but some of them are even more specific, where we have newer technology that's very, very exciting, something called BiTE therapy, where if you imagine a drug that has 2 arms, one arm that can capture the cancer cell, one arm that attaches to the immune cell, and it brings them together and enables the immune cell to kill the cancer cell.
Wow.
We have this is the most recent technology, and it's truly changing
the way that you're
outcomes. Absolutely. So it's a very exciting time. We're truly changing survival, changing quality of life for a lot of our patients, even with advanced cancers.
Wow, that's great. Hey, we're talking with the hospital and Vanderbilt. My guests today are Buffy, the CEO, and Dr. Khalaf from the Vanderbilt Ingram Cancer Center. And we're talking about the partnership that CRMC and Vanderbilt have come together with for our local cancer center here. We got to take a break, though. Stay with us. We'll be right back.
And now back to Today in Putnam County, hosted by Putnam County Mayor Randy Porter.
Welcome back to Today in Putnam County. I'm your host, County Mayor Randy Porter. This week's show, it's about the Cookeville Regional Hospital's Cancer Center and a new agreement partnership that they've come up with Vanderbilt. And I know a lot of you have been asking questions, and so I thought I'd bring the experts on and we'd get a lot of the information out and get those questions answered. I've got Buffy Keys. She's the CEO of Cookeville Regional. I've got Dr. Waleed Khalaf, and he is with Vanderbilt Ingram Cancer Center. And so we're going to talk about this new partnership. So, Buffy, how did this come about? I mean, you just don't just walk in one day and say, hey, let's partner with Vanderbilt and do the cancer center. What led up to all this?
Yeah, that would have been fun if we could have just done it that quickly. But no, honestly, as I said a minute ago, I think it's that we just started looking at how can we get more care here for all of our patients, for everything. Yeah. And we really started focusing on the cancer center because we really did an operational deep dive, and actually Vanderbilt, some of their operational leaders like Dr. Khalaf actually helped me with that. And, we partner with Vanderbilt on a lot of different things, just like we do UT Medical Center and Erlanger and everybody else. But we started doing an operational deep dive, and we started seeing some opportunities. And it was funny because I remember a joke that I made to Dr. Khalaf. Well, hey, one day we may just have to partner in this cancer center. And, we just kind of laughed about it, didn't even think about it. But the more I started thinking about it and what are the opportunities that we can bring home to our folks? What are the opportunities that we can bring to Cookeville, keep people out of Nashville? I have a friend that lives in Nashville and said, if you're thinking about moving to Nashville, don't. But, there's just so crowded right now, and you can imagine a cancer patient having to go down there every day. So that's really just kind of how the chit-chat, if you will, it kind of started. And the more we thought about it, the more we thought this was a really good idea. And Dr. Wright Pinson at Vanderbilt, I've worked with him for many years as well, and several of the people at Vanderbilt, and we just started thinking about it. And I believe Dr. Khalaf can reinforce this statement, but I believe the partnership that we have right now, the collaboration is probably the better word for it, is unlike anything I know we've ever done or that Vanderbilt's done with other folks. They have other, obviously, off-sites and things like that, but this was more of a collaboration. And where it really became impactful that we needed to make a decision on something was last year when I stepped into this role and started realizing that I don't think anybody can get through the healthcare system today unless you collaborate with some of those. Yeah. And we're really good at some things, and there's some things that we need collaboration partners with, and cancer was one of those. And I thought, this is a no-brainer for us. So we talked about it for months, obviously. I will tell you, this collaboration, once we really started talking seriously about it, took about 9 months, which I got to tell you, I tell Dr. Pinson all the time, that's pretty fast for Vanderbilt, but we're fast talkers. So we're just thrilled, and like I said, we're so looking forward to the future for our cancer patients and their families and just our region.
About, isn't it? It's about their citizens.
It is.
And you just don't cover Putnam County.
No.
You've got a whole region here depending on you, and you've got these counties like Clay and Jackson and Pickett that
don't forget Fentress.
Fentress don't even have a hospital.
That's right.
That are coming here. And so I've got a friend that healthy, no issues. This has been a couple of years now. And when they started having this cough and hoarseness, and went to the doctor, and they couldn't find anything, but it just kept on and started running a test, and they found out he had lung cancer.
Wow.
So the doctors that he saw said, not a whole lot we can do. We'll we can get you a little treatment or something. And they didn't take that answer. They didn't want to take that answer, so they came to Vanderbilt. Saw one specialist down there, and the lady, it was a female doctor, and she said, you're just too healthy to have stage 4 lung cancer. You've got nothing else wrong with you. You just don't look like a cancer patient. And she said, I think I can help you. Well, 2 years later, I mean, he's fine. But the driving to Nashville for all those treatments, therapies, and everything, that was a real hardship. And, you feel bad enough, I'm sure, with having the cancer, but have to go backwards and forwards. And so this is going to stop prevent a lot of that, where that they can get those treatments here, right?
That's exactly right. That's truly what we're striving to do. I mean, we have, like Buffy said, we have many cancer centers around Middle Tennessee, but this is truly a different model for us. It's a true partnership with Cookville Regional Medical Center. And, a lot of those exciting new treatments that we offer at Vanderbilt that truly are changing outcomes in patients' lives, we're proud to bring them here to Cookville to serve the patients and serve the community here.
Another story that just stuck out just recently, one of the ladies that I go to church with, she started having cardiac issues, and we got a great cardiology group here. They did every test they could come up and said, man, we're sorry. We can't find anything wrong with your heart. Well, she kept having the same issues. So her husband said, let's go to Vanderbilt. Let's see if they can find anything. Went to Vanderbilt. She wound up having a brain tumor. So it wasn't her heart. It was a brain tumor. And the doctor said, this is going to be a tough surgery, but he said, I think I can get 50% of it out, and then we'll work with the rest of it. The doctor actually got 98% of it out. The little localized radiation you have where you're only hitting that one little place, she just finished that, and they said, everything looks great. Yeah. Mm-hmm. And so there's all kinds of success stories. She had her radiation here, loved it. Doctors at Vanderbilt took care of her, the surgery, and loved it. So, I mean, this marriage has got to be good, Buffy. I mean, I just can't imagine
we're thrilled.
that.
Absolutely thrilled.
I mean, we're very fortunate to have that kind of hospital here in Tennessee, especially a teaching hospital, and they tend to be on the cutting edge, don't they, with things, and to be able to bring those things here.
Well, the research alone that Vanderbilt does and that they're involved in is just, it's second to none. I mean, it's nationally ranked in every area, and to have that here in Putnam County, in our 14-county region, sometimes it makes me speechless just thinking about it. We're just so thankful to have that.
We are. I go back to the days of the little bitty small Cookville General Hospital. When I came to work for EMS, I mean, I think the ER had 3 beds maybe or something. I mean, it was just really small. And to look what that the hospital has turned into to be a regional facility, we are so blessed in this community to have it.
We are.
We got to take another break. You're listening to Today in Putnam County. I'm your host, County Mayor Randy Porter. We're doing a special show today about Cookville Regional's Cancer Center and a new partnership that they're doing with Vanderbilt. Stay with us.
And now back to Today in Putnam County, hosted by Putnam County Mayor Randy Porter.
Welcome back to Today in Putnam County. I'm your host, County Mayor Randy Porter. This week's show is about Cookville Regional Hospital's Cancer Center. If you hadn't heard already, they've got a new partnership with Vanderbilt that is really going to bring us to the cutting edge when it comes to cancer treatments and being able to, even though the Cancer Center has been there for many years and offered great service, this is only going to increase that and maybe some of that specialized treatment stuff that's going on now. You won't have to drive to Nashville to get it, to be able to get it here at Cookville Regional. Guys, cancer months, October and November is cancer months, breast cancer, colon cancer, all those. Dr. Khalaf, we were talking about early detection, and you're seeing more and more young people that are having cancer. I know my wife that she had breast cancer, and she had her mammogram every year, right on the dot. Nothing one year, next year they found something. But that early detection allowed her to have a great outcome from it. So how do we get these folks to go and have their tests and everything?
Yeah, no, we absolutely need to take this opportunity to remind the listeners of the importance of screening. This is Breast Cancer Awareness Month, obviously. So getting screening mammograms early, the recommendation is starting at age 40, but that's just a recommendation for people who have high-risk disease or who have family history. They may want to start earlier, of course, and that's something they have to discuss with their physicians. With the rise in cancers in young adults, especially GI cancers, the screening for colonoscopies, the age is now getting lower and lower. The recommendation is now to do it at age 45, and it will probably actually be even lower. And again, for people who have any signs or symptoms, it has to be done earlier. For people who have high-risk disease, it has to be done earlier. Cannot emphasize enough that early detection absolutely changes survival. And so you want to detect those early to have a curative treatment approach.
You hear people say, I don't want to do that. But, I mean, I was thinking about a friend that I have. She died recently, and she didn't go have her colonoscopies like she's supposed to. And all of a sudden, she starts having symptoms, and she goes, and then it's too late because, I mean, that cancer can grow for years, and you not even know you got it unless you go have your test. And, all of that's easily available, isn't it, Buffy?
Absolutely.
I mean, y'all are
Absolutely.
doing those every day at
Absolutely. We do
hospital
colonoscopies all
outpatient?
day long, EGDs, if somebody
Yeah.
feels like something's going on with their esophagus. And, we all know our own bodies.
Yeah.
And whether we're in that screening phase or not, and I'm so glad, Dr. Khalaf, you mentioned that about the colonoscopies age being lowered to 45, because I wonder about that when I see and hear of people that are 30-something years old and getting colon cancer. But, we all know our own bodies. And if you know and feel something's not right, don't wait. Just call your physician, call your local provider, whatever county that you're in, and get in to see us, because we would love to take care of you. And again, catch it early, we're going to take care of it for you.
Yeah, putting it off is not a good thing. You said something during the break that I want to make sure that we mentioned. Even though you're partnering with Vanderbilt to bring in all these great doctors and all these great treatments, you're still Cookeville Regional Medical Center,
Absolutely.
right? You're still about treating our local patients. And I hear that, they sold out to Vanderbilt, or they did this, or they did that. None of that's true. All you're trying to do is just improve what we've already got,
Absolutely.
right?
And I mentioned that earlier about collaborating with people that are better than us at certain things. In cancer care, we felt like we were doing a fantastic job, but we want to do even better. Mm-hmm. But we are still committed to being a community-owned facility. And, we're one of the few in the state. And people ask us all the time, how do you do this without being part of a healthcare system? And I will tell you how. It's because we care about our people. We care about the people that we serve more than anything. Yeah. And we care about each other. And all the money that we make, all the profit that we make goes back into our medical center. It goes back into our equipment. It goes back into better cancer care. It goes back into the salaries of our individuals. So when I say that I say all the time, our core competency, it really is our people taking care of our people. That always means something to us, and it continues to. But yeah, we're still a community-owned physician. Listen to me, community-owned hospital, and we're going to stay that way.
Amen. So that's a good thing. So we were talking in a break too about the healthcare shortage. Some things that y'all said just really kind of blowed my mind a little bit. I mean, I know we had the shortage of doctors and we've had the shortage of nurses in the past. Buffy, what you got a shortage of now?
We were at a recruiting meeting a couple of weeks ago, and we had a group come in that we use to help us recruit all of the different specialties that we have, and whether that be laboratory, nursing, whatever it may be. And we were astounded by the fact that the number one position that's hard to fill right now, it takes 87 days to fill a position of a radiologic tech. So if you're thinking about doing X-ray or MRI or any of that, we're trying to be creative with these local schools and say, hey, we will do whatever we can to train you as much as we can. If you want to go into X-ray, we'll train you up to MRI or CT, because if you think about it, you cannot have a hospital without an imaging program. And we've got a fantastic imaging program, and they are so busy, and we just need more recruits.
That just kind of blowed my mind that we had a shortage of X-ray techs. Yeah, and we've got local schools here that teach it, and so guys, if you're looking for a job or a career, I mean, you can have guaranteed. A great career and that go to that. Dr. Khalaf, you're seeing some things similar, but you were talking about some other shortages that you're seeing in Vanderbilt.
That's true, right? Really across the hospital system, not just with physicians and nursing, but with technicians, especially radiology, like Buffy mentioned, pathology technicians, especially, which delays processing of samples and biopsies, and ultimately delays the result, of course. So there's clearly a surge across the institution, and it's national.
It is. It's nationwide.
It is.
And I don't know what happened. We didn't have it too bad back before COVID and the tornado and stuff. It seemed. I mean, we had some shortages, but nothing like what we've had since then.
Mayor Porter, I think honestly, when COVID happened, it was a realization for people, and it was a true gut check for many healthcare folks, because they thought at that point, kind of like I did when I was in the National Guard and Desert Storm. Yeah. I thought, oops.
That's a big wake up call.
It's a big wake up call.
Yeah.
And by the way, Godspeed to all the National Guardsmen that have just left us here in our area. But I think it's a wake up check. Is this what I really, really want to do? A gut check kind of thing. And I will tell you, the people that have stuck with it, there's nothing more rewarding.
You took the words out of my mouth. And
nothing.
When I got into EMS as a paramedic, I knew I wasn't going to make a lot of money. But the rewards that you get spiritually and emotionally and everything is unbelievable. So we got a couple minutes left. If someone wants to know more about the Cancer Center, if they've been listening today and they say, I've got this question, can they reach out to someone and talk at the Cancer Center or someone in your office to talk to?
Absolutely. We have a physician liaison that actually goes to physicians' offices and talks to those folks. But also just call the Cancer Center and just talk to the directors and the administrators in there, or even, set up a call with a physician. We're more than happy to talk people through this because this is the scariest moment of their lives. We understand that. And, once you hear that cancer diagnosis or presumed cancer diagnosis, you really don't hear anything else. And it sure would be nice to have a comforting person on the other end of that line. And that's, Vanderbilt's taking care of all of the physician providers and taking care of the treatments and things. And all that we're trying to do on our side is make sure that patient gets everything they need emotionally and support. So please just call.
Absolutely.
The phone number's the same.
Hadn't changed in years.
Hadn't changed a bit. Nope.
Y'all are redoing a wing of the hospital that you're getting ready to open. Can you talk about that opening date and stuff?
If you'll remember, we had a ribbon cutting, if you will, last year. 5 West, which used to be the old Tenbrook Hospital within a hospital. It was our internal psych facility there that closed down right before COVID hit all of us. And we have redone that space. We've got 20 new beds up on 5 West and 6 dialysis space. We just actually walked up there last Thursday with our board of trustees, and it's absolutely beautiful, and our patients deserve it. I tell you, one of my favorite parts about the whole thing is, Cookeville and Putnam County and all of our region is known for our outdoors parks and things like that. And behind every bed, we have images of local parks and local waterfalls and things like that. So neat. It's absolutely beautiful. We hope to have patients in there by December 11th. If not, it'll be the first of the year. But we're rounding the corner on that one.
It's ongoing.
Yep.
I mean, y'all keep stuff going on all the time. You got projects going, but it's to better the medical treatment here in our community. That's what it's about.
That's
Proud of you, Buffy.
Thank you.
Coming from Fentress County.
I know, that's saying.
I'm just kidding. I'm just kidding. Dr. Khalaf, appreciate having you from Vanderbilt. We look forward to the great things that's going to happen with Cook Regional and Vanderbilt. Thank you for being here today. Hey, we got a couple of events to tell you about coming up. November 2nd and the 3rd, it's the 5th annual Cookeville Christmas Market at the Putnam County Fairgrounds, 10 to 4 each day. November the 9th, it's a Saturday at 10:30, will be our annual Veterans Parade. It'll start at the square there in front of the courthouse on Broad and go down to the depot. Come out and join us to help honor our veterans. And then on November 30th, we got a new event that we're going to try this year. It's going to be called Christmas on the Square. We're going to have train rides and games and bounce houses and free photos with Santa and all kinds of booths. And then the finale that afternoon will be lighting of the square with all the Christmas lights in the tree. That's going to be on November the 30th. That's the Saturday after Thanksgiving, 2 to 5 p.m., and it's going to be in conjunction with Shop Local, where we asked you to shop locally here in our community and keep our dollars here. Thanks, Buffy and Dr. Khalaf, for being here today with the show. That's our show for this week. Hope you join us every weekend for Today in Putnam County. I'm County Mayor Randy Porter. Hope you have a great rest of your weekend, and may God continue to bless our great county.
You've been listening to Today in Putnam County, hosted by Putnam County Mayor Randy Porter.